Just tell me when you're starting.
Okay, I've started it again now.
Hello, everyone, and welcome to this webinar where we are discussing the FRCR 2B exams and how to approach the Vivas, especially in light of the changes. So we're doing two webinars. This is the first one, and the next one is next week on a Monday. So I hope you can attend both. The idea is that I didn't want to kind of um, kind of make it overwhelming. So we just cover one thing. And really, the purpose of this is to help those who are sitting the exam in a month, but also those who are sitting in September, because the ideal time to start preparing for this exam is kind of now, especially if you're sitting in September, you've got to give it 3 to 6 months. So that's the purpose of starting so early. But if you're doing it next month, then I expect that you are already well on your way and you're kind of there, and you just want to get some last minute sort of tips. Now, the path may seem quite steep, especially with the changes in the exam, but in some ways, the changes are actually quite positive. And but like any mountain that you have to climb, the key is to focus on the next step, not the entire climb at once. And what we're going to do is use this guide as a trail map, if you like, to show you what's ahead, how to prepare for each section, and what tools you need to reach the top, which is success. There are lots of milestones. There'll be a few barriers on the way, but I want to say on behalf of Revised Radiology, you're not alone. We are there to help you, and the whole community is there to help you. And we've had thousands of people who are thankful for the help that we've given, and we want to continue that help. And by the end of this session, I hope you feel more confident, more in control, and more ready to climb. Okay. My name is Koshi Jacob. I'm a consultant radiologist. I've been working with hundreds, if not thousands, of candidates sitting the FRCR exam. As you can see from my qualifications, I've got a good clinical background, but I did my fellowship in 2007, having done a 5-year training scheme in the UK. Well, I did it in my 4th year, and the CCPC is a coaching qualification that I've got, which happened in 2017. So we're going to guide you through the new structure. We're going to talk about not just what's changed, but how to succeed. And I'm going to give you a clear breakdown of the changes, some practical preparation strategies, some scoring insights, and some exam mindset tips. Now, most of you, I hope, have got something from the Royal College website, as well as maybe attended the webinars that they run. But I'm just going to repeat some of that just to make sure that it's very comprehensive. Now, let me introduce you to this quote, okay? Change is the end result of all true learning. And I wanted to say that because it captures the heart of what we're dealing with. So you've got to connect it all to the FRCR changes, the exam changes. The exam is evolving. It's not to make things harder, but to really reflect what competent real world radiologists need to demonstrate. And that's, I think, what makes the FRCR exams quite unique. Whereas most exams just try and test you to see, do you have the knowledge to be a good radiologist? The exam is actually testing you to, do you have the right knowledge, but do you have the right skills? Do you have the right safety mindset of a radiologist? We're going to, in the next few years, we're going to have lots of tools to help us become safe, AI being one of them. It's going to make us safer, but nothing is, but it's not going to replace you. And the exam is really going to test, are you the kind of person who knows how to, what are the things that are necessary for a patient in real life, okay? The change may feel uncomfortable, but it's a sign of progress. Now, if we treat these changes as an opportunity to sharpen our approach, not just to pass the exam, but also to grow as radiologists, then that challenge becomes purposeful. And this is your chance to not just adapt, but to kind of level up, become a better radiologist. And I was saying to a few candidates who we had a session with yesterday who had not got through the first time, I actually think it's a great opportunity for me personally. If I hadn't failed the first time I sat the Viva exam, I don't think I'd have been as good a radiologist as I'm now. And also, it probably wouldn't, Southwest FRCR, revised radiology, all that might not have um, happened. Now, now change um, now change is hard. So let's start with what we're going to cover. We're going to go through the introduction. We're going to have a format overview. We're going to do scoring, new platforms. We're going to look at the standardized question styles and how to prepare, and then the next steps to success. Now, for a lot of candidates, this might feel quite familiar. The image of someone running, you're studying, you're doing your best, and suddenly the exam changes. It feels like the goalposts have changed. Now, if you feel like that, you're not alone. And a lot of candidates have expressed concern, confusion, and in some cases, even panic. But change doesn't mean the exam is unreachable. It just means that it's different. And once you understand the format, the scoring, and the expectations, it becomes manageable and almost predictable. And that's what we try and do in Revise. We try and get you to the position where you're so comfortable that you're predicting what's going to happen. You're still heading in the right direction. So we're just trying to prevent you from being hoodwinked in the last minute. Okay, so let's shed some light. Let's look at what's actually changed. So in the past, you had 2 sessions, each one 30 minutes, of which it was one examiner, one for 15 minutes, and the other examiner for 15 minutes. Now, in reality, that hasn't changed. You still have a 30-minute session where what's changed is that instead of in that session trying to do as many cases as you could do, and the purpose of that was to get a good average. So you would typically see 10 to 12 cases in a half an hour period. Now you'll see 6. And even though I wouldn't say it's sort of, I would say you must really be aiming to see all 6 cases, and then you're going to get an average. So if you want to get your average right, you've got to see those 6 cases. Okay, you'll get 2 examiners per session, but it also means that if you finish early, like if you finish at 20 minutes or 25 minutes, you finish the 6 cases, which I don't think is going to happen because the cases are not the same as the old kind structure where you might have an x-ray that you could do in 1 or 2 minutes. They're much longer cases. They're much more like you'll encounter in the MDT, or you'll encounter reporting and a clinician comes next to you and says, you know, could I get your opinion, please? And that's the kind of thing. So 6 cases in total, 2 sessions of 30 minutes in 1 hour, you'll see a total of 12. Now, you could say that's quite a few cases to get assessed in, but they will help you, okay? Now, each session is assessed by a pair. So you're assessed in total by 4 radiologists, which gives you 4 independent judgments. Which, like before, leaves it balanced and fair, but it's even more balanced and fair because the cases are the same for all the candidates, and therefore the likelihood of you getting a difficult case and another one getting a difficult case is not going to be there. So at least in the half day that you're in, all the cases there will be the same, and they will standardize it across the whole exam. Okay. So what's changing? The main bit that's changing is the scoring system, the more standardization, and the exam platform. So previously, the scoring system is, I think, probably the biggest shift. Okay, you're no longer judged by overall impression, but each skill is assessed individually. I spoke to a candidate yesterday who actually got quite poor scores on the Vivas. So he asked for feedback. And when he got feedback, his scores were actually between 6 and 5.5, but he got a 4.5. And that didn't make sense. And the reason why that used to happen is because the examiner would then overwrite everything that you've done and say, I think this patient, this examiner, you can feel like a patient sometimes, should not, this candidate should not pass, and therefore they give you a low score to fail you. And that won't happen. You'll be assessed very fairly, and all the cases, as I said, will be the same. It is done through a RISA platform. So all the issues with cases not downloading, all these issues with MS Teams, all that is gone. You're now doing it on a platform, and you will be assessed digitally, okay, like you would in real practice. They're not meant to trip you up. They're actually trying to make it better. But let's look at the scoring system. So each score case will be independently marked by both examiners in both stations and in both sessions. Okay, and you'll get feedback from two different perspectives, and this increases fairness. And this is how they mark now. They've made it very clear what you're being marked on. So let's say you have a case, and they will be testing you on each of these four things, and then they'll give you a separate score for communication. Okay, and communication is important. So this is where you get practice communicating your findings and your thing to, because that's what you have to do in an MDT. You have to communicate. And so let's say for score one, you get excellent for knowledge, your observation, you get a clear pass. Clinical judgment, perhaps clinical reasoning is just pass, and uh, but clinical safety is like borderline fail. So they give you a mark for each of these things, and then they add it all up, okay? And then so let's say the score is then, and then here they multiply it by 6 because there are 6 cases. So they'll multiply that score again based on these scores, 4, 3, 2, 1. And then if you fail in that, they give you 0. And they give you a total score of 480. So this is why you really do need to see all 12 cases. Okay, so the maximum you could get is 12 times, so there are 12 cases, or let's say four, let's say excellent there, so that's 4 times 4, or 4 times 5, that's 20, 20 times 12, 20, yeah, basically it comes, I think they give you 2 marks for each or something, and it comes to a total of 480, and you have to get 281 to pass, okay? So the case material is a wide range of complexity and modalities. There's a higher performance expected on routine common cases than complex ones, and it covers all the major clinical radiological subspecialties. So in a packet, you will typically get 1 case from each of the main modules, okay, so that it's very fair, and they're testing you at least twice on each module during the whole thing. The assessment focus is on observation, logical interpretation, and reasoning. And you have to place the diagnosis if you get it in order of probabilities. If you give differentials, make sure that you prioritize your differentials. Don't just list everything. Prioritize it, say what's the most likely, and be able to justify the investigations you're going to suggest with clinical safety in mind, okay? Because above all, the examiners want to see that you're clear and you've got reasoned decision making, so that you're safe, logical, and you're a confident person. That's the kind of colleague they want, okay? So they're really trying to assess, do I want to work with this guy in 2 years' time? The cases are marked as a whole, not as images. So that means that, let's say they show you an X-ray, and then you do the X-ray, and then they say, what you're going to do next, and you say, okay, I'm going to do a CT. They show you the CT. You get marked for the whole case, rather than in the past where you got marked for each individual modality that you did. Okay, so the other thing is the examiners will have some standardized questions to ask you. Now, it might be that when you present, some of those questions are already answered. For example, if they say, what is the management, what's the next management of this, or that might be a standard question. But let's say in your presentation you've already addressed that. They won't ask it again because it's already covered and you've ticked it off. So they'll only ask you the questions that have not been sort of covered in that, and they will ask you all those questions so that it's fair and everyone gets asked the same questions. Unsafe answers are not an automatic score fail, but can result in a low score for that particular case. Now, what are the kind of questions they could ask you? So they could ask you questions. And now they haven't been very clear in the presentations. So we are kind of guessing here, but I'm hoping that many of you will come back to us after the exam and tell us the kind of questions. But here we are sort of predicting the kind of questions they could ask. They could say, what could be the next imaging step and why? Would ultrasound or CT be more appropriate, especially if you say the wrong thing? Would you use contrast? What lab test would you support? What else could it be? If they might have a question on differentials. They will usually have a question related to that particular case that made it interesting and brought it to the exam. So the examiner who submitted the cases, because I spoke to one of the examiners who's setting the questions, and he was saying that there might be something about that specific case that helped them make the diagnosis or was a contributory factor. So they can ask you something around that. They can ask you questions around who would you discuss with next? Who would you refer this to? Uh, would you need admission? Would it be an outpatient case? Would would you need biopsy? So these are the kind of things that you could be, when you're preparing for the exam, you should be asking yourself these questions so that you are prepared if they ask you that about a particular condition. Now, so the platform, the examiners have control over the case and the progression. The candidates can take control of the mouse and scroll and point, and the tools available are zoom, window, pan, scroll, and reset. Now, we had to develop our platform to mimic this, and we have. So we now have a platform which we are showcasing or using during our course. So the Everlight Southwest FRCR course, you will be able to practice this with the software that the college is doing. So we've seen the software, we've reconstructed it, and you'll be able to practice using it on the course. Um, for those on our combined subscriptions at the moment, no, we won't be able to give you access to that. But if you have the longs and the shorts, it's the same platform effectively. And it's really important to practice before so that you're not sort of stuck on the day. You need to have lots and lots of practice seeing different kind of cases with the platform, which the long case platform is very similar. The one that we have anyway in Revise is very similar to what you'll get in the Vivas section. It's almost identical, except that you don't have those answer boxes. And the candidates can indicate the finders using the mouse point. Now, how do you prepare? Think of the exam as a mountain trail. It's a climb. Every step counts. And unfortunately, unlike what people think, these exams, all of them, are not about cramming the night before. You can't cram because even for 2A, it comes from clinical experience. And I was speaking to someone this morning who was trying to prepare for the 2A exams, just sitting and doing questions. And I was saying, actually, I think you should go to the ward as well, or not the ward, the hospital, and practice seeing cases and discussing with your clinicians and discussing with other radiologists. Do some clinical work because that's where you will learn the most. Go to the MDT meetings. That's where you learn a lot of stuff. So it's about building skills gradually. Now you can practice that in a platform where you have all that information, and the revised platform, as I'll show you, has it. But make sure that when you see a case, you're thinking about the observation, the reasoning, what are the safety things they can ask you, and how you communicate. And the best way to communicate, I'll explain later, could be you could self-study. So you could practice 6 cases in 30 minutes. You could simulate it real time, just practicing yourself, talking to yourself if you like, setting a timer, and don't pause and avoid checking answers. Get yourself a set of regular questions that they could ask, and treat each case as the real things. Um, have a mix of easy and difficult cases, and this kind of focused repetition builds up muscle memory or brain muscle memory, and you'll start to feel more confident. And you can use past Viva cases, which you have access to on the revised radiology platform. We've got, I think about 150 or at least 75 to 100. I think it may be actually 150 packets with about 10 to 20 cases each. So you have more than enough material, and some of the cases will. You will notice that they're very similar to the exam. Those who have sat the exam before. Use a timer, record your purposes out loud or your presentation out loud, and use mirror rehearsal. Now, look out for things like, am I speaking too fast? Am I too soft? Do I look nervous? Are my explanations structured or logical? This will help reduce your anxiety, okay? And having a timer helps you build realism. And it might feel awkward to start with, but over time, your delivery will improve, and you'll train your mind to get more composed. Um, but and you can create a Viva checklist, okay, a playlist of tricky cases, and flag the difficult ones, the ones that you find difficult. Flag them and look at the explanations that are there, and compare your answer to the explanation that's on the website, because there's a very clear explanation. There's also a sample presentation there, which you can practice on. For many of the cases, most of the cases will have a sample presentation, so you can start seeing how you should present. But I think better than self-study is study groups. And that's something that I've been pushing for a long time. And we now have candidates who every day they meet together, almost every day, and they prepare in groups. So here's where you have duos or trios. You have the third person being an observer, and then they rotate. And again, they present, they get some feedback from the other candidate who's standing as an examiner and the observer, and they can then look at the correct answers on the platform. And you rotate, you do as many as you can, and get yourself some questions. Ask yourself some questions, so that you get exposure to all the roles, and make sure that you rotate to get exposure. So here's some domain-specific practice. In terms of knowledge, I would create some cheat sheets for each subspecialty. Focus on hallmark signs, key differentials, common traps that you could get. Review them regularly to solidify your pattern recognition. In terms of reasoning, I would practice ranking 3 differentials. So get yourself the 3 differentials and rank them, which is why is one more likely than the other, and use clinical context and imaging features and typical presentations to do that. For safety, for every case, scan for red flags. If I miss this, would this cause patient harm? And have a clear plan of what to do in terms of escalation, recommending urgent imaging, or MDT discussion. Okay. And then cover communication. So record yourself presenting cases, listen back to them. And if you're in a study group, get feedback from the other candidates on how you presented. Was the tone good? Was the pace good? Was it logical? Are you speaking too fast, which is a problem with people from the Indian subcontinent, like I'm doing now, probably? Are you sounding confident? Do you have a clear, calm delivery? Because that makes a difference between a just pass and a clear pass. Okay. So here's my roadmap to success. You're going to see lots of cases in the exam platform as much as possible. Attend the online Vivas that we run every 2 weeks. Um, make sure that you're not just seeing cases, because in reality you're not going to see enough. They're going to be very common cases. Okay, that's the other thing, that the exam is going to reflect real life, so it's not going to have all these esoteric diagnoses. Might have one or two of those, but on the whole there'll be day-to-day cases that you will encounter in real life. So the skill is in being able to think logically, present it well. The presentation is going to is it really has marks now. Okay, and I would attend courses where they're using the new format. Okay, so we have some offers for you, for those who want to demonstrate, and I'm going to show you now the Viva platform. Okay, that we have anyway. Um, so I've got it ready now. So at the moment, like I said, because we've got 20 to 30 cases in every packet, we can't put them into the RizaKind platform yet. That might come for the September exam. We'll have a few sets in our platform, but at the moment, you're able to look at the cases, okay? Look through all the cases. And then once you present them to your guy in the study group or yourself, you can look at the report. So you can read the report, you can look at the differentials that are there, the interpretation, the management. There's an AI assisted sample presentation. So this is a sample presentation that's been made by AI. I have to be very clear, but it is taking into account everything that's here. And the prompt that we gave it is quite good, and I've been very impressed by the answer. In fact, if you gave this kind of presentation, I reckon you'll do very, very well. The other thing is there's a little bit about discussion, and there's also a presentation of a candidate presenting the case. Okay, so you will be able to watch that and see that. So let's go to the next case. Again, 15 year, it has a history. There'll be cases. You'll have reports, very quite the list of observations, interpretation, your principal diagnosis, differentials, management, and AI-assisted sample presentation, which in this case is quite long, but that's the kind of stuff that you could be talking about. And then there'll be a little bit teaching around that discussion and some key features. So you're able to learn as well on the platform. Okay, so that's what I wanted to show you. And that is available to you. Sorry, let me see. That is available to you on this platform. So we've got a special offer for anyone who's going to do this for the June exam, because we know that if you haven't taken a subscription, it's quite short notice. So from today till the day of the exam, we will give you a 1 month subscription, and we'll extend it for free up to the date of the exam. And we'll, on top of that, we'll give you 15% off for either, if you only want the written subscription or the Viva subscription, we'll give you 15% off. But if you want the combined subscription, which has the Vivas, the writtens, and I'll talk about the guarantee in a minute, we will give you 35% off. However, we normally have a guarantee with our subscriptions, which means that if you take the subscription and you fail the exam, we will give you an extra month for free. Now, that guarantee with these kind of discounts, we cannot give it, especially because it's only a month away. We don't know how much work you're going to do. So, however, if you can demonstrate to us that you have done all the written packets and you've done at least 50 Viva packets, and you will have a learning management plan. If you can demonstrate you've done that, then we will give you an additional month free after the exam if you fail. Okay. So that at least till the results come, you can then just extend it till you pass. But I'm hoping that all of you will pass. But honestly, it's quite late, so we don't want to give a guarantee at this stage. but we will if you demonstrate that you've worked hard on our platform and you've done all 40 short case packets and 30 long case packets. Okay. To get the offer, we don't have a code or anything. You'll have to write to us at info@revisedradiology.com and we will send you an invoice. So in order to find the price, all you need to do is, let me show you what you need to do. You go to the Revised Radiology website, which I'll show you now. Go to the exam 2B, find the price of the 1 month subscription. In this case, for the Vivas, it's £400. You'll be paying 15% less of that. And when you write to us, we will send you an invoice for that amount. Okay. So in this case, for the Vivas, the cost will be 400. Let me just calculate for you so you know exactly what to do. 400 multiplied by 0.85. It'll cost you £340 plus VAT. If you want the combined subscription, it will be, so you know exactly what you're paying for, is 750 times 0.65. It's £487.50 for 1 month subscription of the combined, but you get everything. We have increased the discount on the combined because we know that your chance of passing is much higher when you've got the combined subscription. Okay. So for a few extra pounds, well, maybe something like £100 or £200 more, even less than that actually, £100 more, you'll get the combined subscription, which has everything. And so write to us only if you're prepared to pay that amount. Don't write to us asking us how much is it going to cost. That's what the price is. It's £487.50, and we will give it for free up to the date of your exam in June. If you're sitting the exam in September, this doesn't apply. These offers don't apply. The offer then is for you to apply for trainee pricing and get a price based on that. Okay. So what I've done, I've demonstrated. I want to just show you that some of the things you need to do. Sign up to, especially if you're sitting in September, you're going to try out your website, try out the demos. There are demos of all the subscriptions. Make sure you've applied for trainee preferential pricing if you are within 3 years of, or you've finished your training, you're in training, or you finished your training at least 3 years before. Okay. If you've done your FRC, or if you've been in training 10 years ago, or you finished training 10 years ago, then that doesn't apply. This is only for trainees because it reflects the fact that trainees usually get paid less. You can also apply for a scholarship. If you're in a poor country or you're finding it difficult to afford it, you can apply for a scholarship. Doing a scholarship usually means that you need to give something back. Usually after the exam, you need to commit to doing some Viva sessions with candidates in the future so that you continue, you give it forward. You give it, you continue giving to the other trainees. And if you have any questions, make sure that you book on a strategy call with Becky, and the number is there. And she will be able to show you, sort of give you a little strategy, or if you need any help with any part of the website or to apply for a scholarship. So here is where I stop. It's now 1 hour. Actually, it took much longer than I thought. But you're welcome to ask any questions whatsoever. Okay, and I'll try and answer them. Let me see if there are any questions here. There was a question about, was there a session yesterday? No, there wasn't a session. There was a session with candidates who had failed the exam. There wasn't a strategy session. Yeah. Okay. Are there preset window settings? I think the best thing to do is to look on the website and see there might be preset window settings, but I'm not sure with the Viva section. I can't remember. So you need to go on to the RISA platform on the website and have a look. So, any other questions? The low income country discount, no, it hasn't been scrapped. No, there are 6-month subscriptions. So the question is, has the low income country discount been scrapped? No, there's still a discount for people in low incomes. If you're in training, then you get low income discount. You get the trainee pricing for that. If you are not a trainee or you've done your training more than 3 years ago, that's what I meant. Then if your income is less than £1,000 a month, then you can apply for low income pricing, irrespective of whether you're a trainee or not. So you just need to. And you can apply for 6-month subscriptions by extending. So I'll just show you how you do that. Let me show you what you do. So you click on enroll now and view pricing. There's 6 months
You're
there.
not sharing your screen?
I'm not sharing my screen, sorry. Okay, so what you do is on the website, you click on there, click on enroll now, click view pricing, and then log in. You'll have to log in first, and then there's 6 months. But if you want more than 6 months, you just click to add to cart and select the date that you want it up to. You could have it as long as you want, but obviously the price increases. If you want it till 2026, the price increases. But if you have, if you're a trainee, if you're in a low income, for example, you get up to 35%, I think, for the combined. Is that correct, Joanna? I think you can get up to 35% off. So I would really recommend you go to the website, I'll show you where it is. Well, actually, let me just go to reviseradiology.com, click on trainee pricing, and then it shows you how to apply. The best way to apply is when you get onto the platform, on the top right, you can apply here, apply for trainee pricing, and it gives you a few questions. Are you a training or within 3 years of training? If you click no, is your gross income less than? You say yes, you may be eligible. Would you like to take advantage? Then you fill up your stuff and you can apply for low income. But you have to prove it. You have to give us a pay slip or something. So that's how you prove it. Okay. Any other questions? Which imaging modalities and systems are more important for Vivas? For Vivas, I would say cross-sectional is more important. CT, MR, ultrasound, fluoroscopy. In the old days, X-rays was really important, but I reckon what they've done in the college, they've moved all the X-rays over to the short cases. And they will have some X-rays in the Vivas, but they'll be they'll be films that are part of a bigger case. So it's quite unlikely that you're going to get one X-ray as a case, unless it's got a lot of findings on it, which is not very likely, or there's enough to discuss. So that's what they've told us. Okay. Now, I hope the college has been straightforward about that. We'll know only when the exam is run. But they've told us that it'll be complex cases. There will be no cases. When I spoke to one of them, said there'll be no cases that are just X-rays on their own. So the Vivas focus on cross-sectional, more complex stuff. Systems, it's equal. It's equal. So it'll be the pediatrics. There'll be one case, or in the 12 cases, there'll probably be 2 pediatrics, 2 GU, GI, no, GU, breast, and adrenal. So from one of those, there'll be 2 GI cases, 2 thoracic and chest, heart. Sorry, thoracic and cardiovascular, or cardiac. There'll be 2 neuro, and what have I missed? I've missed one, musculoskeletal and trauma. So it'll be equal. Okay, that's what I'm told. Are there any books? No, You don't need it. I really don't think you need books. I think you just need practice. It's not like your exams in wherever country you're from. You don't need books. You've got all the knowledge you need from 2A. You've done everything that you need. Now you just need to focus on practice, 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 and you need a platform to do it on. For a low income country, the discount low income, which is I so Arun, I don't know where you're from. Uh, Low income, there are countries like Pakistan and and Egypt and some of the other countries. India and countries like that are low middle income. Uh, but if you want me, I don't know, Joe, can you give the discounts? I can't tell it off the top of my head what those discounts are, but
Yeah,
we could,
I'll just put those in the chat.
yeah, she can put in the chat. So India is a low middle income country because the incomes are not as low as some of the other countries. Um, but honestly, if you're sitting the exam in June, ignore all that because we will give 35% to everyone who's sitting the exam in June, okay, for the combined subscription. If you are applying now, it doesn't count for people who've already part of the system. They've already got their discounts. This is for anyone who wants to subscribe now. The offer is only for people and it's only for the June exam. Now, it could work out that if you're sitting the September exam, you could still apply for this pricing and then extend it. But you would need to buy the 1 month course, and then I don't know how you could do that actually because we need an invoice. So you would only get 35% off the price of the first month, okay? And then you'd have to pay the normal. So it's 25%, Joanna said, for FRCR to be combined, which is quite good actually. You know, everything we do in Revise goes back to the candidates. We don't make a profit. We don't run this to make a profit. If there are any profits, we give everything to charity, or we give it back to the candidates in terms in in discounts or scholarships, or we are a not-for-profit organization. Even and the reason why our subscriptions are more expensive than other subscriptions is because we put so much into it. We put so many examiners into it. We put a lot of money into improving we can't get this for free. You can't develop this for free. So we've got to pay teleradiologists to work up the cases. We've got to get a quality team to make sure they're good. We've just highlighted a quality issue with the short cases, which we've had to sort out, and all that costs money. And we're giving you a discount for trainees on the basis of some people from in better income countries being able to pay more. So I just wanted to say that it is a not-for-profit. We are running for that, okay? But everything comes back to you at the end of the day. Any other questions about the exam? Particularly, any questions about the exam? It's possible actually that you've had all your questions answered from the talks that the college gave. But if there's anything else that you're not sure about, it might be that I know some more because I've spoken to examiners. I think I've mentioned everything. Um, I had a recent conversation with a FRCR examiner about a couple of them, and I got an idea. I mean, essentially, I was asking more about the kind of cases, and I was specifically interested in the short cases because those are completely new. There's nothing like it in the exam before, so I've had to get some more clarification. Okay, if there's nothing more, then we'll end the call there. We'll send you all an email with a link to the recording if you want to watch it again. And also, if you have any questions, you can write to us on info@reviseradiology.com and get on a call with Becky if you want any further information. Okay, thank you all. Bye-bye.